Welcome to The Edit with your host, Vivian Cole. Brought to you by Vogue Media Agency, the podcast where branding, visibility, and influence are curated with intention. Each week, we cut through the noise to explore strategy, storytelling, and what it really takes to build a brand that's seen, heard, and remembered.
Welcome to a special episode of The Edit brought to you by Vogue Media Agency. I'm your host, Vivian Cole. This week, The Edit is proud to participate in Podcasthon 2026, a global charity podcast initiative taking place March 14th through March 20th, 2026. During this powerful week, podcasters from around the world are dedicating episodes to spotlight nonprofit organizations and causes that are making a real difference. Today's conversation centers on a mission that could not be more urgent: saving lives and empowering people. We are highlighting the work of The Caribbean Voice, an organization dedicated to suicide prevention and addressing abuse across the Caribbean and the diaspora. Joining us today is Annan Boodram. This episode is about awareness, action, and the reminder that sometimes 5 minutes of your time can truly save a life. Welcome, Annan. For listeners who may be hearing about the Caribbean Voice, TCV, for the first time, can you share what saving lives, empowering people truly means in the context of your work?
Well, we started this mission in 2014, focusing on suicide prevention in Guyana, because at that time, the World Health Organization had deemed Guyana to have the highest suicide rate in the world. So that slogan, or whatever else you want to refer to it as, came out of this mission to prevent suicide, saving lives. And as you save the lives, you empower them so that they're not in a position to have to revert back to suicide ideation or consider suicidality. But then we extended our work, and it seemed also to have relevance to almost every part of it, the domestic violence, the sexual abuse, so we just kept it. Femicide is a significant issue across the Caribbean. And femicide is the end result of domestic violence or intimate partner violence. So there's the issue of being able to prevent that femicide, whereby you're saving a life. And then if you do that, then you move to the next step, which is to empower them. So it runs through a gamut of similar issues that affect, our focus is the Caribbean, so that affect people in the Caribbean and in the diaspora.
TCV often says 5 minutes of your time can save a life. Why is early intervention so critical? And how can everyday people recognize when someone needs help?
Late last year, we completed a 5-module training program with religious and community leaders from the Caribbean community in Queens. The focus was on mental health first aid. And the entire idea of that program, which we've done elsewhere and which we plan to continue with, is to give people the tools that they can use to identify the early warning signs, whether it's suicide, whether it's domestic violence, whether it's sexual abuse, whether it's some other mental health condition. Early warning signs, early intervention means that you're preventing those issues from reaching critical mass. Because once they reach critical mass, from there to fatality is a very short distance. So for example, if I'm aware of the warning signs of suicide, and I see what I think are warning signs relating to somebody in my community, my job is then to get that person some sort of professional help. Ideally, a counselor or psychologist, but there might be layers before that can possibly be approached, especially since across the community, psychologists are not that easily accessed. Across the Caribbean. So if you intervene early, you get them early help. Now, if that person to whom I associate the warning signs with, if I just let it go, it can move to a place where the issue becomes chronic, the person moves from whatever the situation is to hopelessness or helplessness or both, that takes the person into depression. Depression leads to suicidality. Suicidality leads to the act of suicide. And it's kind of similar. They're kind of similar steps across the board as it relates to other issues as well. Early intervention actually saves the life and in some cases can prevent fatal harm.
Suicide, mental health, and abuse are still difficult conversations in many Caribbean communities. How does TCV create safe spaces for people to speak openly and seek support without fear or stigma?
Well, one of the things we tell people is that anything to do with mental health does not make for sexy conversations. When we began this journey, the very first need was sensitization and information dissemination. That there is still, in different Caribbean countries, that process is at different levels. There is more of it in some nations, there is less of it in others. So we still have not crossed that border yet. But it begins with putting out information, sensitizing people. But we have also learned over time that just merely talking about this, just merely writing about it in the newspaper, talking about on the TV, posting on social media is not enough. Because these issues, they're personal in so many ways. And as an educator, I know that the only way I could have reached my children, my students, was to develop trust with them, was to let them see me as somebody they can depend on who can actually help. So those traits have to be transferred to the mental health activists, and I know for a fact that every one of them I know have that ability to develop trust, that ability to develop empathy. That's one part of it. The other part of it, the actions have to be collective. So Caribbean Voice has worked in collaboration with numerous organizations across the Caribbean. And in fact, here in the Diaspora, for example, that training last year I was telling you about, we did it in collaboration with the New York City Department of Mental Health and a number of other organizations. So it's also the question of bringing more people into the process who can become the link between the help that is available and the people who need the help. And then developing the capacity to speak with empathy and to listen with sincerity and to make the person who is speaking the center of that process. It's not about me, the listener. It's about you, the speaker. I can't step in and say, I understand what you're saying. I know what you're saying because I have not walked in your shoes. And that process has a lot of danger points there because in our traditional conversations, we do things that would be no if you're actually talking with somebody who needs that help. So the safe spaces are created by developing those kind of processes, by bringing more people into the collective to deal with it, by collaborating with all those other organizations that are also doing it, and by attempting to get access wherever and whenever possible.
What types of programs and services does the Caribbean Voice currently offer, and who can access them?
Well, I should preface my answer to that by letting your listeners know that the Caribbean Voice is registered in the United States. We don't have offices anywhere, not even in the United States. We are a totally voluntary organization. All of our members have a day job or they do other things. So the time they give to this is all voluntary, unpaid. We don't have a paying staff. So what that means is that we're not in a position where somebody can make a call and immediately access help. But what we do is that we do, for example, we do webinars. We have one coming up at the end of this month on dyslexia, and it will be led by Chantel Morgan, and a dyslexia interventionist from Barbados, on the 27th of this month at 6 p.m. New York City time. So we do webinars online, we do workshops online, we do panel discussions online, We also do workshops face-to-face. We've done a number of face-to-face workshops. We do symposiums. We do lobbying. We've done a lot of lobbying, especially in Guyana, because that is where we started. And our lobbying has led to a number of things being put in place that were not there before. So we do a lot of lobbying. We do advocacy, a lot of advocacy. We run campaigns. For example, we had started this campaign to get counselors in schools. I'm not saying Caribbean Voice is the only entity doing that. There are other entities doing it. But from where we started to where we are, there are now schools in places like Guyana, Trinidad, Barbados that do have counselors. In some of the small islands, that is probably not the case. So combination of all those things allow us to be able to, and we have our own set of counselors, highly qualified, highly experienced. Like everything we do, their services are pro bono also. We do have phone numbers out there. Our members are always scanning the internet to look for signs. People who we've helped in the past, and people who know about it also act as ears and eyes. So sometimes I'll get a call or a message from somebody saying, so-and-so, and then we follow up. The jobs of people like me is not to attempt to counsel, because we don't have the skills. So what we do is we ask some basic questions, and then we try to persuade the person to accept counseling. One of the issues we've had is that in some countries in the Caribbean, people are very reluctant to take counseling for a number of reasons. One of which for us was really significant because they didn't have confidence. And in fact, there are instances of people who did counseling, and then that entire, whatever transpired between the person needing the counseling and the counselor ended up in the public domain. And that person ended up killing herself, dying by suicide. So people who know us and have access to our services know that we're highly confidential. Even I don't know what transpires between the person being counseled and the person that is doing the counseling. They will only come to me if in that process, and this is part of their training, there is something there that has legal connotations. Because like everybody else, we have to follow the law also. That's it. We have developed a track record of doing what we say, of offering all this kind of training, of offering referrals for counseling. We don't only counsel ourselves. We have tabulated list of counselors across the Caribbean, in the diaspora, and even in the United States, for example, because we have had cost to refer people from Canada and who are not Caribbeans and from the United States to counselors. So we had to know how quickly we could get that done, and we had to know where to send them to. So we have all these databases in place. Well, I call them databases. They're not technically databases, but all these sets of information. Mm-hmm. And we're able to I'll give you one example. Some years ago, one of our members saw this post on Facebook where somebody said, I'm going to the seawall now. I feel like going to the seawall. Now, I don't know how familiar you are with Guyana, but generally when somebody states, I'm going to the seawall to jump over, you know that person is undergoing issues that has led to this suicidality. So two of our members in Guyana and myself, we got in contact with the person, and we were on the phone with that person from about 7 o'clock in the evening till about 4 o'clock in the morning. We had to persuade that person, because when first we said, we're getting you a counselor, his first response was, and this too is one of the things you find in the Caribbean, I think you find it in all parts of the world. Oh, me don't want counseling. Counseling is for mad people. Good thing one of the person with us was an actual, was trained somewhat in counseling, not a technically not part of our counseling team. She's a nurse. So we were able to persuade him, and we called a counselor, and made an appointment for him 8 o'clock the next morning. He turned up that there at 8. There were no signage to the psych ward. He asked a few people who told him they didn't know for whatever reason. You think that if they work there, they should know. So he milled around for a while, and then he got really frustrated. And he made another post again, well, now I'm going to the seawall. So one of our members in Guyana had to leave for work, jump in a taxi, go to the hospital, meet this person there, and stay with him until 11 o'clock, when this counselor who had made an 8 o'clock appointment arrived at 11 o'clock at the hospital. Now, if we had not been able to send somebody to spend those hours in between with this person, there is a possibility that that person would have committed suicide. I mean, I'm using the wrong term. These days, we don't say committed, because commit has, like you commit a crime, it has negative connotations. So we say the person has suicided or died by suicide. So those are among the kind of issues you face, you know. But thankfully, that person got the counseling and was okay. So, you know, because we're spread across the Caribbean and the diaspora, we are able to act quickly when it becomes necessary.
Because all of TCV's services are provided free of charge, how do individuals and families typically connect with you when they need immediate support or guidance?
They will either reach out to one of our members. They would send a text message on WhatsApp. They would send an email. They would make a phone call. 718-542-4454 and 646-461-0574.
As a self-funded organization with no paid staff or overhead costs, what motivates your volunteers to stay committed, and how does this structure strengthen trust in the communities you serve?
Perhaps I can start the answer to that question by citing my personal experience. I have one brother who died by suicide. Myself and another brother were suicidal at various times in our lives. I have an aunt who died by suicide. I grew up in a home where domestic abuse, well, in a village where domestic abuse seemed to be normal because it was happening everywhere. And we've been there. We've seen, we've heard, we know. Some of us have had losses, like myself. A number of members in our organization have come through that process. They've been abused, or they have friends and family who've been abused. They've been suicidal, or they have friends and families who have been suicidal. They've been sexually abused, or they have friends and families who've been sexually abused. Some of our members are people who have been working in the mental health sector for years and years, and so they've seen all of this in the process of their work. Some of them came to us after referring other people and seeing the work we've done. They thought that this was something they wanted to be a part of. So people like those, people who've been there, people who have personal or vicarious experience, people who've literally seen it, that commitment to me is stronger than what it would be for people who just come in without never having gone through any of these experiences or bore any of these personal losses, for example. We don't really have a problem as far as the commitment is concerned. We are a registered non-profit organization in the United States, but we don't have a hierarchical structure. We have a management committee that draws from, I think, about 8 Caribbean nations, as well as UK and the US. So the management committee is the one that makes decisions, and in that process, we reach out to members all the time. And we have segments within the organization. We have a fundraising segment that comprises singers, all of whom have used music as a way of advocacy and information dissemination after they came into the Caribbean Voice. So our entertainment segment that contains of entertainers and media people, they're the one who plan the fundraisers. Then we've got the counselors, as I said, highly qualified, either a master's or a doctorate. They're the ones who do the counseling. And then we've got the people who raise the funds are also our spokespersons. They use their platform to put out messages out there because, like entertainers, they have large followings on various social media and so on. We've got a board of directors. They don't get involved in the day-to-day operations. They help us to access resources, and they offer advice. And then we've got the general membership, kind of like the foot soldiers. And as I said, the management committee kind of holds it all together. So that's the structure. And before that, I talked about the commitment.
For listeners who want to support your mission, whether through volunteering, spreading awareness, or donating, what are the most meaningful ways they can get involved?
Well, essentially contact us, and then we will let you know the various ways in which you can help, and then you choose how you want to help. We essentially tell people that because it's a voluntary organization, you do what you can, how you can, when you can. So some will do more, some will do less. There is no financial membership. So we have people who come in, and let me make this clear. I'm not saying we're an ideal organization. People have come in and people have left. A lot of people came in and left, came in for ulterior motives or looking for something they thought they would find there, or thought that this was where they wanted to be and then realized it was not. So there's a kind of a flow in and out that has been happening from inception. But yes, they contact us, and me or somebody from the organization will chat with them. First of all, to find out, to let them understand what it is this is all about, so that they can decide if it is really something they want to be involved in. And then secondly, we give them the options and they let us know which one of those is something they can work on. But we also have 7 social media sites. We've got Facebook, YouTube, Instagram, Pinterest, Bluesky, X, and we've got a magazine, Global Caribbean Magazine, which is an online quarterly in the form of a flip book, 400-page quarterly. That is also part of our information dissemination and building connections campaign.
Finally, for anyone listening right now who may be struggling or knows someone who is, what would you like them to know about reaching out to the Caribbean Voice, and what first step should they take today?
Well, I would suggest that even before thinking of reaching out to the Caribbean Voice, if you know of NGOs in the nation where you live, reach out to them first because they're on the ground there already. If you know of helplines or hotlines that are available in your country, call them because we've worked with a number of them, and even though they all operate with very limited resources, the commitment of the people kind of keeps them going. They can help. In Guyana, Trinidad, I'm not sure Barbados, and in Jamaica, the government has a number of phone numbers that can be called that are in the public domain. So because if there are issues, time is of essence, we suggest you explore those resources that are available where you are. If you're not able to do so for whatever reason, then you touch base with us via the numbers I call or email, 718-542-4454, 646-461-0574, and the email is caribvoice@aol.com. So once you touch base with us, we do a quick evaluation and then we connect you with one of our counselors. If that is what we think is needed, maybe the need may be something else before that. So depending on the need, we make the connections that are necessary. Oftentimes after they come to us, we refer them back to a ministry or an NGO. We've done that with Trinidad, we've done it with Jamaica, we've done it over here. Because we do have a kind of a list for that matter of NGOs across the Caribbean that are involved on the mental health landscape. We've collaborated with them on a number of different ones and a number of different initiatives. And so when we make referrals, they act on it very quickly.
As we close today's special Podcasthon episode, I want to thank the Caribbean Voice for the work they do, quietly, consistently, and compassionately, every single day. Their mission reminds us that advocacy doesn't always look loud, and impact doesn't always come with recognition. Sometimes it looks like answering a message, listening without judgment, or showing up when someone feels completely alone. During Podcasthon 2026 and beyond, let this episode serve as a reminder that community saves lives and empowerment begins with care. If you or someone you know is struggling, support is available and it is free. Visit caribvoice.org to learn more about the Caribbean Voice, explore their programs and services, or reach out for support. You can also support their mission by sharing this episode, starting a conversation, or giving your time in whatever way you can, because saving lives doesn't always require a grand gesture. Sometimes it just takes 5 minutes. Thank you for listening, and thank you for being part of a global movement that believes podcasting can be a force for good.
Thanks for listening to The Edit with Vivian Cole, brought to you by Vogue Media Agency. Be sure to subscribe for more insights, share this episode with your network, and join us next week for another conversation on building brands with clarity, confidence, and impact. Visit voguemedia.us.
Vogue Media Agency offers comprehensive services to help small to medium-sized businesses, faith-based and nonprofit organizations, content creators, and entrepreneurs establish and grow their online presence. Focusing on website design, landing pages, social media management, podcast training, branding, weblog creation, and public relations, Vogue Media Agency provides a convenient one-stop solution for clients looking to elevate their digital footprint. What sets us apart is our personalized service and niche expertise. We are your marketing consultants. Contact us today.
To contact Vogue Media Agency, call 212-470-2730 or visit voguemedia.us.